James, do we have another caller on the line, or?
Yes, thank you, gentlemen. We actually have another email question here. It reads, do you think the new government will be approachable?
It'd be absolutely yes. I think that is the answer right now. Quite simply, we are still in the very early stages. The Executive Council just got sworn in on the 29th, and here we are on the 5th of July. I think it is the 5th, and we are now just starting to re-engage with government. There has been, as with every transition, there's always a blackout period, and we're now past that. And so now comes the fun part where we actually get to sit down and start dialoguing, and we're very optimistic. So I think they will be open. It's every indication up until this point has been saying just that.
A lot of the work we did pre-election on the Pharmacist Care platform with OPA and neighbored pharmacies, I think sets the stage for a collaborative environment and a positive patient-focused approach. And we are certainly going to be collectively partners for government to align with those policy objectives so that we can see advanced scope, we can see some of the growth potential and better patient care in the neighborhoods across the province. So this is the time to solidify those relationships and really position the value proposition we have as industry experts and bring that that intellectual bandwidth to the government and look at where do we create that capacity, ending the hallway medicine and really be positioned as a solution to drive towards better efficiencies in the system, as well as certainly care opportunities. The high accessibility of pharmacies and our ability to manage patients' conditions with that trusted relationship is the part of what we have as our value proposition. And we have to do, out of the gates, be very proactive. But I also don't want to say that everything's going to be roses. I think we have to be realistic that this is a government that promised efficiencies of 6% across the board. And it's going to be incumbent on us to look at that in a proactive way so that we're part of that solution and not in a reactive position where we're going to get blindsided by reductions and things of that nature. So a lot of that groundwork has already been done with the Pharmacist Care platform and our 4-point plan, but there's going to be more work to demonstrate the value that they're getting today so that we don't face a similar situation of reductions.
Sure, and approachable doesn't always mean the answer will be yes.
Yes,
correct.
But all you can ask for is a fair hearing to be able to put your policies and positions forward. I would add to what these gentlemen have said that this is a premier that more people probably have his cell phone number than any other cell phone number, and he takes great pride in returning calls. You also have a new Minister of Health who, while she was the health critic in the PC caucus, was very accessible. Now, understanding that the demands on the time of the Minister of Health are greater than the demands on the health critic's time, she was always really accessible to stakeholders. Remember, too, this is someone that served as our patient ombudsman in Ontario and has had to deal with patients and families coming forward to talk about their challenges with the healthcare system. And I should add, too, that as you both know, as well as the Minister of Health being in place, that Dr. Ruben Devlin continues to be an advisor to the government on healthcare. So Ruben was a surgeon and the CEO of the Humber River Hospital. Two things that he emphasizes is, one, he's big on customer service, and pharmacists and pharmacies know all about that. And he's looking for innovation, certainly Humber being Canada's first fully digital hospital.
Yeah.
He is looking for people to come forward with innovative, patient-facing, customer service-focused solutions, and I think that bodes well for the profession and the industry.
And we said exactly that with our pharmacy platform. It was about collaboration. It was about building partnerships, a true partnership between the profession and government. And like Justin said, and yourself, Joe, it doesn't always mean things are going to be roses moving forward. But if we maintain that patient focus, maintain the efficiencies that pharmacy can bring to the health system and that innovative approach to smoothing out that patient experience, I think it would come logically that the provider experience would also likely come hand in hand with that. So we're